Welcome to the Dr. Izzy's Medical Podcast channel.
Question: What is the mechanism of action of finasteride? Answer: inhibition of 5-alpha reductase. Question: What is the mechanism of action of fingolimod in the management of relapse-remitting MS? Answer: agonism at S1P receptors 1, 3, 4, 5, inhibits lymphocyte movement from lymph nodes into the central nervous system. Question: What is the mechanism of action of flecainide as an antiarrhythmic? Answer: Class 1C, blocks all morphological forms of the sodium channel, thereby significantly prolonging the refractory period at the AV node, minimal effect on AP duration. Question: What is the mechanism of action of flumazenil? Answer: antagonism at benzodiazepine binding sites at GABA A receptors. Question: What is the mechanism of action of fluoroquinolone antibiotics? Answer: inhibition of DNHI-RAse, topoisomerase II, and topoisomerase IV. Question: What is the mechanism of action of fluoroquinolone antibiotics? Answer: inhibitions of cytoplasmic topoisomerase II and topoisomerase IV. Question: What is the mechanism of action of flutamide? Answer: antagonism at androgen receptors. Question: What is the mechanism of action of formoterol? Answer: beta-2 agonism, thereby causing bronchial smooth muscle relaxation. Question: What is the mechanism of action of foscarnet? Answer: direct inhibition of viral DNA polymerase, viral RNA polymerase, and HIV reverse transcriptase. Question: What is the mechanism of action of furosemide, loop diuretics? Answer: inhibition of NKCC2 symporters at the thick ascending loop of Henle. Question: What is the mechanism of action of gabapentin and pregabalin? Answer: inhibits voltage-gated calcium channels as a GABA analog. Question: What is the mechanism of action of galantamine in the treatment of Alzheimer's disease? Answer: inhibition of acetylcholinesterase. Question: What is the mechanism of action of ganciclovir? Answer: guanosine analog, inhibition of viral DNA polymerase, thereby causing chain termination. Question: What is the mechanism of action of gemfibrozil? Answer: activation of PER-alpha, thereby yielding increased lipoprotein lipase expression. Question: What is the mechanism of action of glucocorticoids as immunosuppressants? Answer: inhibition of NF-κB, thereby suppressing both B and T cell function by decreasing the transcription of many cytokines. Question: What is the mechanism of action of griseofulvin? Answer: interference with microtubules, thereby disrupting mitosis. Question: What is the mechanism of action of guaifenesin? Answer: thins respiratory secretions. Question: What is the mechanism of action of guanfacine? Answer: selective activation of alpha-2 receptors at postsynaptic receptors at the prefrontal cortex. Question: What is the mechanism of action of H2 receptor antagonists in the treatment of acid peptic disease? Answer: competitive inhibition of H2 receptors at parietal cells, thereby leading to a decrease in gastric acid production and release. Question: What is the mechanism of action of heparin? Answer: cofactor for the activation of antithrombin. Question: What is the mechanism of action of hydralazine? Answer: increases cGMP in smooth muscle, thereby causing relaxation, vasodilation. Question: What is the mechanism of action of hydroxychloroquine? Answer: suppression of T cell response to mitogens, decrease in leukocyte migration. Question: What is the mechanism of action of hydroxyurea? Answer: inhibition of ribonucleotide reductase, thereby leading to a decrease in DNA synthesis. Question: What is the mechanism of action of abutolide as an antiarrhythmic? Answer: blocks potassium channels, thereby increasing AP duration and effective refractory period. Question: What is the mechanism of action of abutolide? Answer: potassium channel blockade. Question: What is the mechanism of action of imatinib in both CML and gastrointestinal stromal tumors? Answer: inhibition of tyrosine kinase. Question: What is the mechanism of action of imiquimod? Answer: TLR7 agonism, thereby stimulating mononuclear cells to release IFNA and pro-inflammatory cytokines. Question: What is the mechanism of action of infliximab? Answer: binds to and neutralizes both soluble and membrane-bound TNF-alpha. Question: what is the mechanism of action of iodine 131? Answer: emission of beta particles that induce necrosis in follicular cells of the thyroid. Question: what is the mechanism of action of ipodate and iopanoic acid in the treatment of thyroid storm? Answer: inhibition of peripheral conversion of T4 to T3, inhibition of T3-T4 release. Question: what is the mechanism of action of ipratropium? Answer: antagonism at muscarinic receptors, M1, M2, M3. Question: what is the mechanism of action of ipratropium? Answer: competitive inhibition of ACH muscarinic receptors. Question: what is the mechanism of action of isoniazid? Answer: decreases the synthesis of mycolic acid. Question: what is the mechanism of action of isosorbide dinitrate? Answer: increases NO and vascular smooth muscle, thereby causing an increase in cGMP and smooth muscle relaxation. Question: what is the mechanism of action of ketamine? Answer: blocking of NMDA receptors. Question: what is the mechanism of action of ketoconazole in the prevention of hirsutism in PCOD? Answer: inhibition of 1720 desmolase, an enzyme involved with steroid synthesis. Question: what is the mechanism of action of labetalol? Answer: non-selective alpha and beta adrenergic antagonism. Question: what is the mechanism of action of lamivudine? Answer: competes with deoxycytidine triphosphate for incorporation into viral DNA, thereby leading to chain termination. Question: what is the mechanism of action of lamotrigine? Answer: blocks voltage-gated sodium channels. Question: what is the mechanism of action of leflunomide? Answer: inhibition of dihydroorotate dehydrogenase, thereby inhibiting de novo pyrimidine synthesis. Question: what is the mechanism of action of leuprolide, goserelin and neferilin? Answer: agonism at GnRH receptors. Question: what is the mechanism of action of lidocaine as an antiarrhythmic? Answer: blocks inactive sodium channels, thereby decreases AP duration. Question: what is the mechanism of action of lidocaine? Answer: blockade of both activated and inactivated sodium channel blockers. Question: what is the mechanism of action of linezolid? Answer: binding to the 23S subunit of the 50S ribosomal subunit, thereby blocking formation of the initiation complex. Question: what is the mechanism of action of lisdexamphetamine dismolate? Answer: increases catecholamine tone by blocking reuptake and facilitating release. Question: what is the mechanism of action of lisinopril? Answer: ACE inhibition. Question: what is the mechanism of action of lithium in the treatment of acute mania and bipolar disorders? Answer: inhibition of inositol monophosphatase and the inositol signaling cascade. Question: what is the mechanism of action of losartan? Answer: competitive antagonism of angiotensin II receptors. Question: what is the mechanism of action of lovastatin, statins? Answer: competitive inhibition of HMG-CoA reductase. Question: what is the mechanism of action of macrolide antibiotics? Answer: binding to the 50S ribosomal subunit, thereby inhibiting translocation. Question: what is the mechanism of action of macrolides, erythromycin and azithromycin? Answer: inhibition of the 50S subunit. Question: what is the mechanism of action of maraviroc? Answer: binds to CCR5 on T cells monocytes, thereby inhibiting interaction with GP120 and viral entry. Question: what is the mechanism of action of mecasermin? Answer: agonism at IGF-1 receptors. Question: what is the mechanism of action of memantine? Answer: weak NMDA antagonism, stabilizes the glutamate system and balances excitatory neurotransmission. Question: what is the mechanism of action of mercaptopurine and azathioprine in the treatment of inflammatory bowel disease? Answer: inhibition of de novo purine nucleotide synthesis, thereby causing immunosuppression. Question: what is the mechanism of action of mercaptopurine? Answer: inhibition of PRPP synthetase and PRPP amidotransferase. Question: what is the mechanism of action of mestranol in the treatment of ovarian failure or hypogonadism in females? Answer: Agonism at estrogen receptors. Question: What is the mechanism of action of methacholine? Answer: Agonism at muscarinic receptors. Question: What is the mechanism of action of methimazole in the treatment of hyperthyroidism? Answer: Inhibition of peroxidase only. Question: What is the mechanism of action of methimazole? Answer: Inhibition of thyroid peroxidase. Question: What is the mechanism of action of methotrexate in the treatment of inflammatory bowel disease? Answer: Inhibition of dihydrofolate reductase, thereby blocking THF synthesis from folic acid. Question: What is the mechanism of action of methotrexate? Answer: Competitive inhibition of dihydrofolate reductase. Question: What is the mechanism of action of methylcellulose? Answer: Absorbs water in the gastrointestinal lumen, thereby forming a bulky, emollient gel that causes colonic distension and promotes peristalsis. Question: What is the mechanism of action of methyl-DOPA? Answer: Central A2 receptor agonism, thereby decreasing adrenergic tone. Question: What is the mechanism of action of methylphenidate? Answer: Increases catecholamine tone by blocking reuptake and facilitating release. Question: What is the mechanism of action of metoclopramide? Answer: Dopamine antagonist. Question: What is the mechanism of action of metoprolol? Answer: Selective beta-1 antagonism. Question: What is the mechanism of action of metronidazole? Answer: Formation of free radical toxic metabolites in the cell that damage DNA. Question: What is the mechanism of action of mexiletine as an antiarrhythmic? Answer: Blocks inactive NA channels, thereby decreases AP duration. Question: What is the mechanism of action of mifepristone in the treatment of Cushing's syndrome? Answer: Antagonism of GCRs. Question: What is the mechanism of action of mifepristone? Answer: Antagonism at progesterone receptors. Question: What is the mechanism of action of milrinone? Answer: Inhibition of phosphodiesterase isozyme 3, leading to increased CAMP. Question: What is the mechanism of action of minoxidil? Answer: Opening of ATP-dependent potassium channels at arteriolar smooth muscle. Question: What is the mechanism of action of mirtazapine? Answer: Alpha-2 adrenergic blockade. Question: What is the mechanism of action of misoprostol in the termination of pregnancy? Answer: Agonism at PGE1 receptors, thereby triggering uterine contraction. Question: What is the mechanism of action of mitotane in the treatment of adrenal carcinoma? Answer: Suppression of the adrenal cortex. Question: What is the mechanism of action of montelukast? Answer: Antagonism of cysteine leukotriene receptor 1, thereby blocking leukotriene action. Question: What is the mechanism of action of moromonab CD3? Answer: Initiation of T-cell apoptosis via ADCC by binding to CD3.
Thank you for listening Dr. Izzy's medical podcast series. If you want to support this project, please subscribe the channel and like this video. Thank you.